Good afternoon, everyone. You are very welcome to the Supporting Yourself or Those Around You Who Are Experiencing Mental Health Challenges webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to your host, Karen Brennan, Health Promotion and Improvement Officer. Thank you.
Thanks so much, Lauren. Hi, everybody. My name is Karen and I'm a Health Promotion Officer here in DNCC. This is the 18th time on Zoom over October as we come to the very end of October's Staff Health and Wellbeing Month, and we've had over 700 people either attend or watch the webinars on YouTube, which we're delighted about. For our last speaker, we're delighted to have Derek Pepper, who's a team leader of regional services with Shine. And Derek and I have been speaking about the topic of mental health and mental ill health a number of times running up to the webinar. And I know that you're going to find this extremely interesting today. And there's lots of people throughout CHO DNCC who are working, supporting family members or colleagues or service users who are experiencing mental health problems. And it can be very complex for all concerned. So we're delighted to have Derek with us to break it down for us a little bit and to increase our understanding. So thanks so much for joining us, Derek. We'll use the chat function and we've anonymized that. So if you'd like to ask a question, you can do so in comfort and anonymity. Our hashtag for the month of October is hashtag Staff Health DNCC. So if you're on Twitter, do use the hashtag. So without further ado, delighted to have you with us, Derek. Over to you.
Thanks very much, Karen. And again, I really want to emphasize that I really do appreciate the opportunity to be here this afternoon. And as you said, we've spoken about the possibility of being able to speak at the event this afternoon over the past couple of months. And I really am very grateful to have been given this opportunity, because I suppose it's vitally important to be able to meet other professionals, to network with other professionals, to share with them information about the work that Shine is doing.
Yeah.
But also, at the same time, to acknowledge the fact that as professionals, we're also human beings, and we also have families, and we also have our own situations that we're trying to deal with at home. And very often the focus and the emphasis at work is on our professional aspect of things, the support we provide to other people. But it's also very, very important that we have the opportunity to talk about and to reflect on the challenges that we experience, as family members ourselves, and to realize that we also need to be able to reach out for help and support whenever the need arises. So again, a huge thanks to everybody for joining this afternoon, for giving up your lunch break. Hopefully I haven't had to forego food and drink. Hopefully you can enjoy that while I'm speaking. As I said, it is a great opportunity to be here, and I hope that it's going to be informative for you, because essentially what I'm going to try and do this afternoon over the next 30 minutes is to break this presentation down into, I suppose, 3 key sections. The first thing I want to do is give you an insight into Shine, the organization that I work for, because as Karen said, my role in Shine is as team leader of regional services, and I work specifically here in CHO9, but I also cover the Northeast region and the west of Ireland as well. So I just want to give you, first of all, an insight into who Shine are and what our purpose is. After that, then we look specifically at the areas of family recovery, because I suppose that was the area I really wanted to try and focus on today. A lot of the time when we talk about mental illness and mental ill health and everything associated with that, the focus is on the person who has the illness or who's experiencing difficulty. We very often forget, or I suppose the spotlight isn't always shone on the relatives and the family members who are supporting that individual with a mental health difficulty. So that's really what I wanted to focus on today, is the issues that arise for family members and the need for support that family members have. In doing so, then that'll bring me on to the third aspect of the presentation, is when I detail the types of supports that Shine provide in the community. All of the supports that I mentioned today will be available in CHO9. So for yourself, for your family members, and indeed the people who you're working with on a professional basis, everything that I talk about today will be available to you and everybody else that I've just highlighted. So without further ado, I'm going to go into my presentation. So hopefully with the appliance of science, that's going to work all right. We'll soon find out. Let me share that. So can I just get confirmation that that presentation has come up on the main screen for everyone?
Yeah,
Yes.
perfect.
Brilliant, brilliant. Okay, I'll get stuck into it then. And I'll just move these cameras away. All right. So a little bit about Shine just to begin with. So Shine is a national organisation supporting people affected by mental health challenges. Shine actually came into existence about 43 years ago. I think it was 1979 when we actually came into existence. It began as a very small sort of family group, so it did, but it has evolved over the years and expanded. And essentially, as we said, we have a national organisation. We are working with people primarily with self-experience of a mental health difficulty, but also crucially the family members as well. And that has always been the case. Insofar as I suppose we've always been the main provider of support services to the family members of people with self-experience. I mentioned about, I suppose, how we began. The origins of Shine begin with a family support group in Blackrock, believe it or not, working out at the Clonmara services. And way back in 1979, they got together with HSE staff and developed what became known as the Schizophrenia Association of Ireland. We went by that name for many, many years, and some people may still actually regard us as being Schizophrenia Ireland, but we changed our name to Shine about 12, 13 years ago. I suppose the reasoning behind that was, number one, the people who are accessing our services didn't like the name Schizophrenia Ireland, and they wanted us to change it. Number two, I suppose when you're called Schizophrenia Ireland, it sounds very exclusive. It sounds like you only work with people who have self-experience of schizophrenia. And the reality is that we have for many, many years, we've been working with anybody affected by any type of mental health difficulty, be that depression, bipolar disorder, or indeed schizophrenia. So I always like to emphasize that fact because, as I said, some people still are under the notion or the impression that we only work with people with schizophrenia, but the reality is we work with absolutely everybody affected by any type of mental health difficulty. Our commitment is to supporting recovery for all. And I suppose recovery is the concept and the theory that underlines everything that we do, all of the services that we provide, all of the work that we do in the community. Recovery is that sort of that underlying ethos that brings it all together. That understanding that recovery is real and trying to spread that message across throughout the community. And indeed, it's something that has gained traction over the last number of years. I know myself, I've been working with Shine for the last 16 years. I've been working in the mental health sector, you could say in general, for the last 20 years. And it's brilliant to say that at this stage, recovery is something that has become, I suppose, commonplace in anywhere now where you see people working from the point of view of providing support to do with mental health. That may not have been the case 10 years ago, so in some ways it's a very new concept and a new way of working. But for an awful lot of the people here today who are part of this webinar, you'll have been working in a recovery oriented manner for many, many years before that. But to some people, it is very much still a new concept. And from Shine's perspective, we're still actively involved, as I said, in trying to make people aware of the realities of recovery. And that applies to people with self-experience, family members, professionals, and people working in the community. So our vision. Well, our vision is of an Ireland where all those with mental health challenges have the right to recovery and the opportunity to achieve the best quality of life. It's a very simple vision, but it's one that's very, very significant for the people that we work with, because I suppose a lot of the people we work with may have felt that those opportunities were not afforded to them over the years for lots of different reasons. So whilst it's a very simple vision, it's one that we feel we are still striving towards, and that there's still an awful lot of work to do in order to achieve that. As an organisation, we have a very distinct set of values that guide us in our work. Equal rights and opportunities. I'll talk about the UNCRPD on human rights, and that very much is informing the type of work that we do at the moment. And I know for an awful lot of you, it's something that's going to be informing the work and the supports that you are providing in the community. So equal rights and opportunities is one of the key values and core values that we have attached to the work that we do. Mental health challenges are not a cause for discrimination. We want to try and make sure that that becomes, I suppose, the tagline for everything, that just because a person has a mental health difficulty, it doesn't mean that they should be denied the opportunities to explore the things that they want to do in life. There really shouldn't be any barriers or obstacles put in a person's place simply because of the fact that they have some self-experience of a mental health difficulty. A partnership enhances success. I know from my own experience of working with Shine, as I said, for 16 years, a lot of the key successes I've enjoyed have been in collaboration with other people. I've enjoyed fantastic relationships with my colleagues from the HSE and from other organisations in the community and voluntary sector. And together, and only by working together, can we realise, the society that we ultimately would like to see, whereby people with mental health difficulties and their families feel that there is enough support around them to enable them to confront the challenges that they're dealing with, and to enjoy the recovery that we hope that all people will get to experience. But again, we can only achieve that through partnership and collaboration. One of the key areas, I suppose, of work that Shine have been working on over the last couple of years has been in the area of advocacy. Now, when I refer to advocacy, it's not that we have an advocacy service ourselves whereby people can come to us and avail of advocacy. The advocacy I'm talking about is very much on a policy level. So Shine over the last couple of years, and indeed for all of its existence, have been working to try, I suppose, and develop that whole area of advocacy and, implementation of policy, and to be the voice of people with self-experience and relatives when it comes to the development of services and implementation of policy. But over the last couple of years, we have, I suppose, in a more specialized way, tried to be more influential in this regard. And we now have a dedicated advocacy department and an advocacy officer who's been doing an awful lot of work over the last couple of years in the area of advocacy. The key points that we've been working on are become a key influential player in mental health policy and legislation in Ireland, a dynamic advocacy group to implement advocacy initiatives. That's something that's been developed within Shine internally. We have a group which involves staff, people with self-experience and relatives who are feeding into our policy and advocacy, and in doing so then being influential when it comes to discussions around policy implementation and service development. Integrating a human rights-based approach into mental health policies and legislation, as I've mentioned already, that's become crucially important and something that we're really advocating very heavily for. And hosting a national reference group to monitor the implementation of Sharing the Vision. Shine have been tasked with overseeing the reference group that is monitoring the implementation of the Sharing the Vision policy document. That's something that began this year, and the reference group have been meeting regularly to oversee the recommendations from the Sharing the Vision policy document, and to ensure that the policy document is enacted in the way that it was meant to be. That particular piece of work with the reference group, that will be ongoing over the next couple of years. Now, I mentioned about the UNCRPD, and in line with the UNCRPD, Shine supports the integration of a human rights perspective in mental health and the realisation of the human rights and fundamental freedoms of people experiencing mental health challenges. This is something I suppose we've been very, very conscious of, for many years when we talk about taking a human rights-based approach to the work that we do. And I think there's an increased spotlight on that now, especially because of the UNCRPD. So hopefully we will see a more human rights-based approach to treatment, to the development of services in the future, not just in the statutory services, but also within the voluntary sector as well. And that's something that we're essentially working towards ourselves. Now, I also mentioned at the very start of the presentation that recovery underpins all of the work that Shine does. And I suppose for some people who aren't familiar with that term recovery, from a mental health perspective, it carries a very distinct meaning, so it does. Normally, when we talk about recovery from a physical health problem, we're talking about the fact that symptoms are no longer an issue for a person. The person is no longer necessarily depending on, assistance of a mental health or a professional of any description, and they may not be requiring any treatment on an ongoing basis. But as we know from a mental health perspective, that is very, very different, because even though a person might be enjoying a good recovery, that doesn't necessarily mean that they're no longer experiencing symptoms. It doesn't mean that they're not availing of some type of treatment or medication. And that definitely doesn't mean that they're not engaging with mental health professionals or professionals of some description. So when we talk about recovery from a mental health perspective, I suppose this is how we like to try and frame it. So Shine's understanding and practice of recovery is in line with the Irish National Framework for Recovery. And how they've defined it is recovery is about the whole person, not just their mental health problems. Having somewhere to live, something to do, and someone to love is an important part of recovery. Put simply, recovery is living a life with one's own choosing, having dreams and ambitions with or without the presence of mental health challenges, and regardless of the severity of those challenges. So in very simple terms, when I talk about recovery and I support people with the recovery, I'm essentially trying to enable and empower that person to live the life that they want to live, conscious of the fact that that involves a number of different elements. So some of the areas that I would be working with people on are, for example, independent living, financial independence, social networking, relationships, access to education and employment. As well as, for example, supporting somebody with the medical aspect of their treatment. And again, for those working in the HSE, particularly as part of multidisciplinary teams, that's something that you play a crucial involvement in. So recovery, as we can see, is all encompassing. It's a very, very holistic approach to the whole notion and topic of recovery, because essentially we have to take everything into consideration when we're supporting that person. But recovery also applies to family members as well. Sometimes I suppose that word doesn't necessarily seem appropriate to family members, but from our experience, you know, the situation the family members can find themselves experiencing sometimes can be quite traumatic. And as we know, with any trauma in life, there has to be recovery afterwards. So that's why we feel that the term recovery, whilst it's very, very appropriate to somebody who has self-experience of a mental health difficulty, we believe it's equally as appropriate to the family members who are supporting that person with a mental health difficulty. Now, how do we actually embody that? What are the various different themes and aspects of recovery that are important? Well, the Shine recovery concept has really informed a lot of the work that Shine do. And essentially what we can see here, there are 5 core pillars that we believe are very important when we talk about recovery and in the work that we do. As we see them here: connectedness, hope and optimism, identity, meaning, and empowerment. These are the things we try to bring into the work and the supports that we provide to people in the community, be that an individual with self-experience of a mental health difficulty or a family member. We try to ensure whatever supports that we provide in Shine, that we are touching on each of these 5 cornerstones. Now, talking specifically about family recovery, you know, what am I referring to there? Again, I touched on it just very, very gently a couple of minutes ago, but for the next few minutes, I'm going to focus specifically on family recovery and look at the challenges associated with that. So family recovery recognizes that family members and supporters are impacted in a number of ways by their response to another person's mental health challenge. It recognizes that family members have their own emotional support needs through this journey. It is not dependent on the well-being or recovery of the individual with a mental health challenge, and it enables family members to engage in their own recovery, even if the family member with mental health challenges is not ready to consider their own recovery. So as I kind of just alluded to a couple of minutes ago, the journey of recovery for a family member, it's important that we recognize and acknowledge that, because it is real. The journey of recovery for that family member will not always be linked to the journey of recovery of their loved one. I always say this whenever I give presentations, that the journey of recovery for a family member and that of their loved one, they will not always run parallel to one another. Sometimes a person with self-experience will be enjoying a really good recovery, but the family members may not have actually reached that point yet themselves, and vice versa. Sometimes the family will be very much invested in their recovery and the recovery of the individual with an illness, but the person who's experiencing those difficulties may not be ready to go down that journey just yet. So that's why it's very, very important that family members are able to look at their own recovery at any given time and start working on that, regardless of what is happening with their loved one who has self-experience. Now, the challenges faced by family members supporting a loved one with a mental health difficulty. I've tried to, I suppose, break these down into a few bullet points. So family members supporting a loved one with a mental health difficulty will experience challenges in lots of different ways. These can impact on the family member's professional life. So for a lot of family members who are supporting a loved one with a mental health difficulty, they may find themselves having to take time off work to enable their loved one to go for appointments, or maybe to pick up medication, or even just to be there for various different times and needs that their loved one may have. And that can put huge pressure on a family member, particularly in their professional life, trying to seek time off work, or indeed trying to work around work, trying to make these appointments happen without necessarily having to say too much in work, because the family member is trying to protect the anonymity and the dignity and the confidentiality of their loved one. Consequently, social life can be very much impacted for family members. You know, the things that some people take for granted, like meeting up with friends or going to watch a football match or going to the cinema, all of a sudden, these sort of very ordinary, mundane things can become very difficult for family members to achieve. Consequently, relationships can be impacted. You know, marriages can be impacted, friendships can be impacted. And that can be quite devastating at times for family members when they try to recover those relationships. Finances can be affected because, again, if you have a loved one with a mental health difficulty and perhaps they're not working, all of a sudden, maybe family members feel that they're obligated to try and support that person financially. Consequently, physical and mental well-being of the family members will be impacted. You know, if they find themselves under pressure, if they find themselves stressed because they're trying to provide support to their loved one, that can have a massive impact on the mental health and physical well-being of any family member. And finally, then sometimes a lack of information can prove very frustrating for family members. And I suppose I can relate to this myself. Being a family member of a loved one with a mental health difficulty, I can distinctly remember the time when I had a loved one who was very, very distressed. And it was basically put on me to try and get that person the support that they needed. And I distinctly remember being in that situation whereby I had a phone in one hand and a phone book in the other. And this was long before I worked in the area of mental health, and having absolutely no insight or knowledge as to where I should go or what I should do. It's a very intimidating situation for any family member to find themselves in, and extremely frightening, and can be extremely overwhelming as well. So that's why it's important that family members have access to supports, particularly in times of crisis, and especially when they are experiencing this for the very first time. I know in my own personal experience, when I was inducted into the whole area of mental health for the first time. Previously, it's not a discussion I had ever had with that particular family member or any friend or family member. So I found myself suddenly, without any notice, being presented with this situation that I didn't understand. And indeed, I suppose that experience has taught me to be very empathetic towards family members when they do present for support, because I know exactly what it's like to be in that situation where you have absolutely no knowledge or insight whatsoever. And you're hoping that somebody will shine a little bit of light on this topic for you and present some degree of hope for the future as well. And I know for myself and the work that we've been doing in Shine for many, many years, the one basic thing we try to bring to people, especially family members, is that sense of hope and that recovery is real, not just for their loved one, but for them as well. So the challenge for family members in understanding a mental health difficulty, and again, I just kind of touched on this a minute ago, for a lot of family members who find themselves presented with the reality of a mental health difficulty for the first time, it can be very hard to understand and difficult to understand what is actually happening. A difficult aspect of supporting a family member with a mental health difficulty is understanding the ways in which a mental health difficulty can affect a person's behavior. Lack of understanding can lead to frustration and anger within family members and cause fracturing within the family unit. Dealing with behaviors arising from psychosis can be especially challenging for family members, especially when they're dealing with hallucinations and delusions. And some family members will not accept that their loved one has a mental health difficulty and will promote other theories to explain symptoms and challenging behavior. So again, it can be very, very difficult for family members to determine what is maybe difficult behavior and what actually might be an illness. And very often when family members approach Shine, for example, for support, this is the question that they're sort of debating in their own mind. Is this my loved one? Is this just their behavior? Or are they going through a difficult period? Or is there something much deeper here? And if it is an illness or a clinical situation, where do I go and what do I do? Now, one of the things that can impact family members quite extensively is the whole area of stigma and the topic of stigma. Now, when we talk about stigma, we're talking about negative attitudes and beliefs that people have about a particular topic. And in this particular case, it's mental illness. So negative attitudes towards mental illness are still largely prevalent within society. We know that there is a greater conversation around mental illness and mental health at the moment. And that's been quite prevalent for the last couple of years. But it's still a major issue, unfortunately, in Irish society. And it's one that we hope is going to improve as people, develop a greater awareness of the realities of maintaining positive mental health, the realities of mental illness. But we still have a long way to go in that regard. And that's why families are still very much impacted by stigma. According to most people with self-experience of a mental health difficulty, the biggest challenge to recovery is not necessarily the illness, but the fact that they have to deal with the fears, reservations, and negative attitudes of other people. And this is something that people with self-experience and family members as well have shared with me over the years, that they can manage the experience of a mental health difficulty with time, with information, and with support. But the one area that's always problematic and always difficult to overcome are those negative attitudes that sometimes can be projected onto them by other people. Family members can go to great lengths to protect their loved one from stigmatizing situations. And again, I've seen many, many situations in my work with family members where they've gone to great lengths to try and protect their family members from the stigmatized beliefs of other people. And sometimes that can mean protecting them from other family members. I know one family, for example, that I worked with who weren't really able to explain the reality of their child's situation to their own brothers and sisters because they were nervous about what the reaction might be from those extended family members to their child who is experiencing mental health difficulties. So that can bring an added pressure, stress, and frustration into the fore for family members when they're trying to protect their loved one who has a mental health difficulty from the negative reactions arising from stigma. Now, with stigma, we have what is called self-stigma. And self-stigma arises whereby people start to buy into and believe the negative notions and aspects of stigma themselves. So, for example, very often some people will ring me if they have self-experience of a mental health difficulty or if they have depression, for example, and be of the belief that, well, I have depression now, so that means I can't drive my car anymore, or it means I won't be able to engage in a relationship anymore, or it means I won't be able to go to work anymore. And likewise, family members can be affected by these stigmatized beliefs and misinformation, I suppose, if you want to call it that. So when family members begin to self-stigmatize, this can lead to a deterioration in the relationships between family members, their loved one, and the health professionals. Self-stigma arises where family members are influenced and guided by their own preconceived negative attitudes towards mental illness. Some family members may be resistant to reaching out for help because of shame and embarrassment, and denial of a mental health difficulty can result in a delay in the administering of treatment and heighten the risk of incidents within the family. Recovery is also affected. So that whole notion of self-stigma is extremely damaging. And we hope that by encouraging family members to reach out for help and support at the earliest possible opportunity, we can enlighten family members and make them aware of the realities of emotional distress and mental health difficulties, and also emphasize to them that recovery is real. And again, by giving people that sense of hope, hopefully we will be able to limit the damage that is done by self-stigma and indeed eradicate it so that people are not affected by these preconceived notions and beliefs that they may have had prior to their loved one developing a mental health difficulty. Other families may be overprotective and preoccupied with what they perceive to be the long-term limitations of their loved one. Again, this is something that we have worked with families on for many, many years. And I suppose that notion of taking a step back, for family members, that can be extremely challenging, particularly if they spend many years trying to care for and support their loved one. And I've emphasized that word care because, again, we want to try and get away from that notion of family members feeling that they have to be carers. That's not the case. We want family members to understand that recovery, again, is real. Recovery for their loved one is real. But in order for their loved one to realize that recovery, they have to be able to determine for themselves what their life is going to be and what it's going to involve. And indeed, with that comes personal responsibility. Also, as part of recovery, the whole notion of failure has to be accepted. Recovery isn't something that continues on an upward trajectory all the time. Recovery, I suppose, goes in steps. It can go up and then it can go down. We will have those blips and we have to allow for those. in order for recovery to become real for a person. So I suppose once we can sort of help families realize that reality, that recovery isn't, a linear process. It doesn't go always in an upward trajectory, that there will be ups and downs. We hope that we can encourage family members to be more engaged when it comes to taking that step back, giving their loved one that sense of freedom that they need in order to explore various different things in life, and also then to rely more on professional supports that can take some of the burden off family members and enable them to explore their own personal recovery journey. So consequently, as I've mentioned here, they may reject proposed advancements in their loved one's care and development and adopt an almost institutionalized approach to the long-term care of their loved one. And all of this, as I've said, can change with the right support and information being made available to family members. So supports for family members. With the advancement of care in the community, some support is now being made available to family members. Home-based teams, for example, will work with patient and family members towards enhancing their recovery. Multidisciplinary teams, which include occupational therapists and social workers, are interacting with family members and drawing more on the experience and expertise of the family members. And I know myself, I've worked over the last number of years with a large number of OTs and social workers, and I can't emphasize enough the amazing impact these professionals have had, not just on the lives of people with self-experience, but also family members as well, who have benefited enormously from the input that they've received from OTs and social workers. In some areas, family members may be able to seek support from a local mental health association, and where available, peer support groups can be hugely beneficial for family members. Of course, support from the voluntary sector, specifically organisations like Shine, is crucial to family members as well. And again, over the years, from a Shine perspective, I'm delighted to say that, and again, talking from first-hand experience, we've been able to make a huge difference to the lives of family members who are supporting a loved one with a mental health difficulty. And I suppose as of today, what I really want to try and focus on now are those supports that we provide to people, so that I can give you an insight into the level of supports that we provide, and hopefully you'll be able to share that information with the people that you're working with, and also maybe find it of benefit to yourself and your own family members. So Shine, as an organization, we run a number of different programs and recovery services. Some of you may have heard of Sea Change, some of you may have heard of Headline, and then I'd say a lot of you are very familiar with our recovery support services. Sea Change, as you can see here, is Ireland's national stigma reduction partnership. They're responsible for the Green Ribbon campaign. They also have the Sea Change ambassadors who do great work in the community. And then we have the Sea Change workplace program, which has been on the go for the last number of years. Headline is Ireland's national media programme for responsible reporting and provides education, training, guidance and resources to journalists. They also are responsible for running the Mental Health Media Awards every year, and they provide media training to third-level institutions and to all media outlets. So again, I suppose sometimes people don't realise the various different branches of service provision within Shine, and Sea Change and Headline are very much a part of the services provided by Shine all around the year. Our recovery services, I suppose, are the aspect of our services that people are most familiar with. By exploring and building on my abilities and valuing my lived experience, my future is firmly in my own hands. And again, going back to that whole concept of recovery, the 5 pillars that I mentioned through Shine, and that notion that people have to realize recovery through themselves and their own life experience, that's something that we really try to emphasize to people with self-experience and family members alike. Our recovery services begin with our brief intervention and support service. That provides a listening ear, no wrong door, relevant accessible information, signposting, and we refer internally and externally and provide follow-up to people who will contact us via our phone line with pretty much any type of question at all. When people contact Shine, very often it's because of word of mouth. Maybe they've spoken to somebody like yourself working in the HSE, or they've had a referral from somewhere else, and they will ring us. Sometimes not really 100% sure of why they're ringing us. Sometimes they will have a very specific reason and a question that they need an answer to. So through our brief intervention and support service, we hope that we can do that. For those people who require additional support, maybe more long-term support, we have our individual recovery planning service. This is person-centered, it's confidential, it's solution-focused and goal-orientated. And this applies both to people with self-experience and to family members as well. Because again, as I've emphasized, recovery for family members is something that is real. It's something that should be acknowledged. And we try to work with family members on an individual basis as well, so that they can chart their own recovery from the trauma that they have experienced. In addition to that, we have an effort with support groups, and that's very much the case here in CHO9. We have a support group for people with self-experience, and we're also in the process of developing a relative support group. But people from CHO9, be they relatives, can avail of the support groups that we have in County Dublin as well. So it's not exclusively that if you're based in CHO9 that you can only avail of Shine supports in CHO9. Anybody in County Dublin can avail of the supports that we provide all around the county. Our peer support groups are facilitated by peers themselves. So the groups that we have for people with self-experience, generally speaking, a person with self-experience who's been trained in facilitation will provide that particular group. And on occasion, these may be co-facilitated with a Shine member of staff. The support groups are provided in the community and online. They are for people with self-experience of a mental health difficulty and also for family members. We also have a number of education programs that we run in the community. And again, these education courses have been co-produced, which I suppose is very much at the heart of the work that Shine does, that everything we do, you could say, is co-produced by staff and people with self-experience and family members as well. The recovery education programs that we have are Finding My Way, which is a recovery program for people with self-experience. Recovery in the Family and Exploring My Way, they are recovery programs for family members that get family members focused on their own individual recovery as opposed to that of their loved one. We also provide a stress management course, which is applicable to people with self-experience and to family members as well. Our Taking Control workshop, that's a one-day workshop that essentially, I suppose, is relevant to anybody who's experiencing a difficult experience in life, anything that might be causing them any kind of stress and anxiety. Taking Control is relevant for those individuals. And as I said, that's a one-day workshop. If anybody wants to get further details on any of these particular workshops, courses, or the groups, please do feel free to contact us. I'll be providing contact details now in the next couple of minutes. We also do a huge amount in the community. And as I mentioned at the very start of the talk, collaborating with our partners in the HSE, collaborating with our community partners in the voluntary and community sector has been vitally important to Shine throughout our existence. And that will continue. And that'll be very much the case here in CHO9. As our staff get back out into the community after the lockdown with COVID and start engaging and collaborating with various different projects in the community. One of the ones that a lot of people may be aware of is Mental Health Engagement and Recovery, which was previously known as ARI, Advancing Recovery in Ireland. That was a fantastic collaborative project and initiative that is still going today. And hopefully over the coming period, we'll be able to explore that in more detail and indeed embark on other collaborative projects in the community with yourselves and with our community and voluntary sector partners. These are our contact details. The phone numbers I'm providing there, they are for our brief intervention support service. Again, if anybody's any questions that they have about Shine services or questions about their own personal situation, or indeed, again, anybody a family member who requires support, they can ring those phone numbers. There's also the email support address there. Again, people can contact us by email. And of course, then we have our website as well. We have a lot of information on our website and people are very welcome to access the website at any stage. Again, some social media links there. We're active on social media. Anybody can go on to our social media pages and like them and share them. And essentially, that's it, folks. I know I'm conscious of time and I had to try and fit an awful lot in a very short space of time. If anybody does have any questions, please feel free to address those with me over the coming minutes.
Thanks so much, Derek. That was absolutely fantastic. We really got a lot, I think, out of the whole presentation, and just a great way to learn about what Shine is able to do for people. I know we had a couple of questions come in from, can you hear me okay there, Derek?
Yes.
Yeah, I can't see myself on the screen.
Derek, would you please stop your share?
Yes.
Yeah,
thank you.
So somebody was just mentioning that her sister has been diagnosed with a type of I suppose it's an ABI, and she an acquired brain injury, and she's having some difficulties around depression. And this person would like to help her sister, but doesn't really know where to go for to access services.
Yeah, I think in any situation with a family member, and again, people will experience emotional distress and mental health difficulties for lots of different reasons. Sometimes because of a physical health problem, sometimes because of environmental factors like unemployment, relationship issues, whatever it might be. But again, none of us are immune to developing, a mental health difficulty, or indeed immune from emotional distress. And I think the best way we can support anybody initially is by talking to them. And when I say talking, I emphasize listening. I talk an awful lot. I give presentations in the community, and we hear all the time about encouraging people to talk about their emotional distress and mental health issues. But the one thing I do emphasize to people is that it's one thing to talk. It's equally important that somebody's willing to listen. And I think in society, that's been a bit of an obstacle for some people, that they're not always comfortable listening. And in order to be able to determine what somebody's core issue is, we have to listen. Now, if I feel that I'm not able to do the listening part, particularly if it's a very close family member, it's important that I try and find somebody who will be able to do the listening for my loved one. So I think in any situation like that, whereby somebody's experiencing a challenge to their mental health, that they're experiencing emotional distress, that we can provide a space whereby somebody can first of all listen to that person, give them the opportunity to talk about their feelings, to talk about the reasons why they're feeling down, why they're feeling depressed. And once we can get, I suppose, an insight and an understanding into why they're feeling this way, then we'll be better informed as to where we need to go next to reach out for support. And for example, if it's a case that there's an acquired brain injury, just off the top of my head, I'm thinking of, I think the organization's name is BREE. They're a voluntary organization who provide support services in the community to people who've been affected by an advanced brain injury. So again, once you can sort of establish what the real issue is for the person, why they're feeling down, why they're feeling negative, then we can start thinking about where we might go to next.
Okay, and I suppose that would be the same advice that would apply to another person who asked a question around her daughter suffering from low self-esteem and how she can help her. So it's the same thing would apply, really, to speak to her or have somebody else.
Absolutely. I think the most important thing of all that we can do, particularly for young people, is to create an environment whereby they can talk about their emotions in a way that they know that they're not going to be judged for it. They're not going to receive a negative reaction for it, that when they do talk about it, that they're going to receive calm, that there's not going to be panic, that there's not going to be an inquest and an interrogation. Yeah. And the one thing I always say to people is, let's not focus on immediately the why. Let's just focus on what the person is experiencing in this moment. Let them talk about their feelings. Let them talk about exactly how they feel inside, how it's affecting them, and to do so in a way that's open and inviting. And also, I suppose, without the pressure of feeling that, for example, from a family member's perspective, that I have to fix this.
Yeah.
In a lot of these situations, we can't fix the problems of our loved ones. We just can't. We might want to, we might feel the urge to do that, but we also have to accept that we just can't fix everything. And the best thing we can do in that moment is listen. Listen to the feelings, listen to the scenario, listen to the reasons why the person is feeling this way. And then hopefully be able to identify where we might be able to go next, and accept the fact that maybe we will have to bring somebody else into the equation. Maybe we can't just deal with this at home and sort it out at home. We may have to talk to a counsellor. We may have to talk to a doctor. We may have to talk to a GP or a voluntary organisation who can provide some additional information and support to us. And again, that's why I emphasize stigma during the presentation, not to be impacted by stigma and prevented from reaching out for the help and support that we need at the right time.
That sounds like great advice. Derek, thank you so much. I know that there's people on the call today that really did, in the webinar, that really did get help from what you were talking about. Thanks for everybody for your participation as well. There's going to be a recording of the webinar, and you'll be able to access that if you weren't able to watch the whole thing. You'll also receive a very short survey when you finish watching, and it takes about 30 seconds to fill out. And if you put your name in, we're going to be doing a draw for some all-for-one vouchers, which is very handy running up to Christmas. We'd like to remind you again, there'll be a link to today's webinar to be emailed out. And once again, thanks so much, Derek Pepper from Shine. Fantastic webinar, very informative, and I know it's going to be of great help to people here in CHO DNCC. Thanks everybody. This is the sign off from our last webinar. It's been an absolutely fantastic month. We've enjoyed so much having you with us over the month of staff health and wellbeing, and I look forward to seeing you on a webinar again soon. Bye bye from us. Bye bye.